Madam President, I rise to speak to the great debate we're having on historic health care reform, and I'm reminded of the words of a great Republican, President Abraham Lincoln. He said, quote, "We cannot escape history. The fiery trial through which we pass will light us down in honor or dishonor of the latest generation. The occasion is piled high with difficulty, and we must rise with the occasion." That's what Abraham Lincoln said. Madam President, it's time to rise to the occasion, because our friends on the other side of the aisle have chosen to sit on their hands and do nothing. They have no plan. They have chosen to delay and obfuscate. You know, if you look back in history, during the great debates on Social Security in 1935 and Medicare in 1965, our friends across the aisle were on the wrong side of history. But in the end, there was a minority who chose to stand up for historic social legislation and vote their conscience. They were not driven by the far right wing of their party or by radio talk show hosts who demand ideological purity and see any attempt to support health care reform as an abandonment of principle. Each of us is rarely called to act on such significant legislation. And when we are, it is our solemn duty to put aside our ideology, to turn off Rush Limbaugh, and leave politics in the cloakroom. Our vote on this groundbreaking legislation, comparable to Social Security and Medicare, will be one of the most significant votes in American history. It should not be driven by the hope of failure that the other side prays for, rather by the will to succeed for the American people. This Congress will be remembered for this vote for generations to come, and our friends across the aisle will once again be on the wrong side of history. Madam President, we've heard the same tired arguments over and over again. We heard those arguments in 1935 against Social Security. We heard them again in 1965 against Medicare. The same arguments we hear today. History has a way of repeating itself. If past is prologue, historic health care reform legislation will be signed into law despite the naysayers, the fearmongers, the panderers to those who see any attempt at compromise as defeat. To our friends on the other side, this is no longer about legislating, it is simply about obstructing. It is no longer about doing what's right for the American people, but about stopping us from doing anything. It is not about finding common ground, but drawing lines in the sand. My friends on the other side have set up an army of strawmen, as they did on Social Security and Medicare, manipulating the facts to create the illusion of refuting the false claims they created in an attempt to score political points. They stand up the socialist strawmen, call the bill a government takeover of health care, and make Americans fear it. Well, we say let's make sure the Bernie Madoffs of the world and people like him are not selling health insurance. They wave the flag, stand up the un-American straw man, say the bill is against old-fashioned American values and denounce it. We say, don't you dare question our patriotism. Do not dare question our commitment to doing what is right for the American people. They stand up the death panel strawman, claim the legislation would kill grandma, and denounce it as inhumane. We say stop the outrageous misinformation and tell the truth to the American people. They stand up the tax straw man and say health care reform will increase taxes. We say we're making health care entities like insurance companies pay their fair share. They set up the spending straw man and say the bill will indebt the next generation, despite Congressional Budget Office estimates to the contrary. We say you can't pick and choose when to believe the Congressional Budget Office and stand by their numbers only when it's convenient to your cause. For instance, my friend Senator Gregg, the ranking member on the Budget Committee, touts CBO numbers even on his specific bill when they benefit his arguments, for example, on malpractice provisions. But now my friends on the other side conveniently dismiss the congressional budget numbers, showing our health care plan reduces the deficit. So you can't have it both ways. They bring along their partisan straw man, accusing us of drafting a bill or having votes in the middle of the night. We say, how quickly you forget the 4 months that we waited for Republicans in the bipartisan gang of 6, 3 members, 3 Democratic members, 3 Republican members, working supposedly in an effort to achieve a bipartisan effort in health care reform. 4 months. 4 months we waited to work with us in a constructive way, and then they all walked away. So don't come back now and say you had no input in the process when you choose that course. And by the way, these votes, they take place at the times that they take place because the Republicans insist on stopping the process and delaying it and drawing it out. So under the procedures, once we start the process to finish that delay, it ends up at certain hours, 30 hours each time. From the moment that we file the motion to say, you know, that's enough of the delay, let's move forward. And whenever those 30 hours ends, that's when we have to have the vote. But they could consent to have that vote in the fullness of the day and light, but no, they want to have the vote as late as possible, hoping that 60 members who want to see progress on this reform don't come to this chamber and therefore cannot stop the filibuster. And so they want failure. And then they clamor about, look at the time that these votes take place. Straw man after straw man. They have done nothing but block this legislation, as they have throughout the year other legislation, and they will do anything, say anything, to delay, deny, and defeat health care reform. They are on the wrong side of history now, as they were in 1935 and 1965. But the difference between 1935 and Social Security and 65 and Medicare and today is that when the debates ended in 1935 and 1965, when the legislation was weighed on its merits, there were those few Republicans who voted their conscience, those who did not march in lockstep to the demands of right-wing talk show hosts or in fear of Tea Party anarchists. In 1935 and 1965, there were a few on the other side, a few, who voted for Social Security and Medicare because they knew it was right for America. But in 2009, it appears that there will be no votes for health care reform. Not one, not a single vote from the other side of the aisle. Madam President, the ideological differences were as intense then as they are now, but pure, obstinate ideology did not prevail then, as it will in this chamber when we vote. You know, before Social Security was debated, President Roosevelt laid out the changes in society and the reasons why we needed Social Security legislation before the Congress. He said then, and I quote, "Security was attained in the early days through the interdependence of members of families upon each other and of the families within a small community upon each other. The complexities," he went on to say, "of great communities and of organized industry make less real these simple means of security. Therefore, we are compelled to employ the active interests of the nation as a whole through government in order to encourage a greater security for each individual who composes it." That's what he said about Social Security. That's why we needed Social Security and why we realize today that without Social Security, more than half of our seniors in this country would be living in poverty. More than half. If the voices then in opposition would have succeeded. And then the debate began. There was no mention of death panels, but there were those Republicans who raised similar straw men to the voices we hear today. A member of the New York delegation, a Republican, Daniel Reed, said, quote, "The lash of the dictator will be felt, and 25 million Americans will for the first time submit themselves to a fingerprint test." Another said the bill invites the entrance into the political field of a power so vast, so powerful, as to threaten the integrity of our institutions and pull the pillars of the temple down upon the heads of our descendants. John Tabor, another member of the New York delegation, a Republican, raised the anti-business straw man, saying, quote, "Never in the history of the world has any measure been brought here so insidiously designed as to prevent business recovery to enslaved workers." In this chamber, in the Senate, Senator Daniel Hastings of Delaware, a Republican, raised the death of a nation straw man, saying that Social Security would, quote, "end the progress of a great country." In this debate, we have seen the same army of straw men standing against us. They have claimed that health care reform is a government takeover that will threaten the integrity of our institutions, when in fact, we create an exchange of private insurance companies that people will be able to pursue. They say that it will pull down the pillars of the temple and our descendants and leave them in debt, that it will drive private health insurers out of business and put a bureaucrat between doctors and patients. Well, we already have bureaucrats between doctors and patients. There are health insurance company bureaucrats between doctors and patients. The difference is, when the debate ended on Social Security in 1935, with the shouts of socialism and un-Americanism had faded, a few, a minority on the other side, had the political courage to cross the line and vote yes. But there will not be a single vote from the Republicans in favor of this bill. Not a single vote. Our colleagues on the other side want nothing more than to stop this bill, period. Pure and simple. It is their intention to stand in bloc for insurance companies and against any health reform that would protect American families from losing everything if they get sick. Their plan is just to say no, and once again, they will squarely be on the wrong side of history. When President Kennedy and later Lyndon Johnson fought for Medicare, those on the other side raised the same army of strawmen they raised 30 years earlier. They played the same game that they are playing again now. Senator Curtis of Nebraska at that time voiced opposition in this chamber, saying Medicare, quote, "is not needed." This is a Republican senator of the time. Senator Curtis of Nebraska said Medicare is not needed. It is socialism. It moves the country in a direction which is not good for anyone, whether they be young or old. It charts a course from which there will be no turning back. It is not only socialism, it is brazen socialism. In the other body, Congressman Hall of Missouri called it an ill-conceived adventure in government medicine. Those were the Republican voices of the past on Medicare. What senior in this country today, which one of our parents or grandparents believe those words of the past as it relates to their health care today? More strawmen, more fear, more naysaying. All of it wrong then, all of it wrong now. They said bureaucrats would come between doctor and patients. Well, they're wrong. They're wrong. That's why it's interesting to see that today, American Medical Association, the nation's doctors, the people who take care of you when you're ill, the ones who follow your progress when you have maybe a debilitating disease or a lifetime health challenge. Your doctor, the voice of your doctor, not any members of the Senate, the voice of your doctor, said this in support of this historic reform. They said, quote, "This is a time of great opportunity for the American healthcare system. We have the chance to substantially expand health insurance coverage, implement insurance market reforms that promote greater choice, affordability, and security, improve," this is the doctor speaking, "improve the quality of the care, and help Americans live longer, healthier, happier, and more productive lives. To that end," the doctors of the nation say, "we urge all senators to support passage of the Patient Protection and Affordable Care Act as amended." This is the nation's doctors. This is your doctor who's telling the members of the Senate, vote for it. They don't believe the line about that bureaucrats are going to come between doctor and patient. They're wrong, those who are saying that. They call Medicare unpatriotic and un-American. They were wrong again. They said it would mean the rationing of health care. They were wrong. They made the same arguments they've been making for 74 years, and they are still wrong. In 1965, the champion of my conservative friends, Ronald Reagan, issued a 19-minute long, an LP, for those of us who still remember that, a long-playing vinyl recording at the time. It's past gone. They're like antiques now. But it was entitled, "Ronald Reagan Speaks Out Against Socialized Medicine." It featured an impassioned 2,000-word speech intended to get people to write to their congressmen against the idea of Medicare that was beginning to make its way through the Congress. That was 1965. It was referred to as Operation Coffee Cup, something of a precursor to today's Tea Parties. In his recorded message against Medicare, Ronald Reagan said, quote, "One of the traditional methods of imposing socialism on people has been by way of medicine." Sound familiar? Sound familiar in the year 2009, in the debates we've heard here on the floor? When he became president, one of the pillars of his health policy was cutting benefits, in particular through increased cost sharing for Medicare and Medicaid recipients. He was wrong then, just as our conservative friends on the other side are wrong now. Madam President, in the face of yet another landmark piece of legislation, is it possible that there is not one of my friends on the other side who does not in their heart believe we need to pass this legislation for the good of the American people, regardless of ideology? Is there not one of my friends on the other side who will vote yes to help Americans who have lost their jobs and their health care and stand to lose everything if they or a member of their family becomes ill? My friends, saying no to accessible, affordable health care for the American people is too big a price to pay for ideological purity. When I think of what this legislation will do, I cannot believe that there will not be one vote on the other side to provide competition and affordable choices for every American, as this bill does. Not one vote for greater accountability for health insurance companies. Not a vote for more choice and competition for consumers, for programs that will rein in health costs and make policies more affordable. Now, is this bill perfect? No. But it is a great and historic foundation of reform. And yet there will not be one vote on the other side to improve access to quality care for children, as this bill provides for, and the most vulnerable among us, which the bill does. Not a single vote for tougher accountability policies for health insurance companies that are included in this legislation. Not one vote to require insurers to spend more of the premium revenues on health care rather than on administrative costs, executive compensation, and boosting the bottom line. Not a vote to hold health insurers accountable for excessive rate increases, not a single vote on the other side to immediately ban insurance companies from denying children. You hear a lot about the sanctity of life, from denying children coverage for a pre-existing condition. Not one vote for expanding eligibility for tax credits for small businesses and starting the health insurance tax credit next year. That's why it's interesting to note that among the many, many supporters of this, the Business Roundtable, they're quoted as saying the proposed legislation is a step towards our shared goal of providing high-quality, affordable health care for all Americans. It's why the small business majority says the manager's amendment, Senator Reid's manager's amendment, includes new provisions essential for small business protection and survival. That's the voice of business. Not one vote for a bill that promotes competition among insurers and choice for workers, or to test alternatives to civil tort legislation that emphasize patient safety, disclosure of health care errors, and resolutions of disputes. Not one vote. Not one vote. Or for people in my home state of New Jersey and every state who will see direct and immediate benefits from this legislation. Not a vote for every uninsured New Jerseyan who has a pre-existing condition and has been unable to find affordable health insurance in the marketplace. The health of our families is not a commodity. It is not a privilege for the wealthy. It is something everyone should be able to be protected from without going broke. Under this legislation, 1.3 million seniors in my home state will be eligible for free preventive care for recommended services. Seniors will also be eligible for free annual wellness visits to their doctors and will be provided with a personalized prevention plan so that they can stay healthy. And when this legislation is signed, we will have lived up to our promise to fill the donut hole, that gap in coverage under Medicare Part D, to provide affordable prescription drugs to over 227,000 seniors in New Jersey and millions across the country, so that they will no longer have to choose between paying their bills and taking the medication. When this legislation is signed, over 850,000 New Jerseyans will qualify for tax credits to help them pay for health insurance, easing the burdens of premiums, deductibles, and co-payments. It will make tax credits for up to 50% of health care premiums available to over 100,000 small businesses in New Jersey. It will also put an end to the hidden tax that is passed along to everyone in my state to increase premiums and costs to pay for the over $1 billion spent on uncompensated care in New Jersey. And this legislation includes a health insurance exchange that would provide portability, security, and choice for 1.3 million New Jersey residents who presently don't have any health insurance whatsoever. It will increase the number of doctors and nurses and dentists for the 150,000 New Jerseyans, 2% of the population, who live in areas who do not have access to primary care because of a shortage of health care providers in their communities. And yet there will not be one single vote for this legislation on the other side. Not a single vote for any of these health reforms to help hardworking families in my state and in states across the country. Mr. President, this is the politics of no. Pure and simple. I suppose it's nice to say no to health reform when you have the full protection of health care yourself. But it's wrong to say you are unwilling to afford the same protections to others. It's nice to say no to health care when you and your family will not be denied coverage because of the privileged position you hold. But wrong to let even one mother, one father, hear that their child has been denied the medical treatment they desperately need. I say to my friends, how dare you stand in unison on the other side of the aisle and deny to others that which you so fully enjoy yourselves? How can you deny to others that which you so fully enjoy yourselves? It is inconceivable to me that when all is said and done, when our differences have been aired and the debate has ended, that not one of my colleagues on the other side will see the historic nature of this legislation. We can be proud of this legislation, and I know when the dust settles and the provisions of the bill become clear, America will be proud of it as well. This landmark reform legislation includes state-based insurance exchanges, creating a fair, open, competitive marketplace for affordable coverage. It includes an amendment I proposed for long overdue consumer protections for emergency services. When you're getting sent to a hospital, you're not thinking about calling your company and saying, is this the right hospital? Am I going to be covered? Without regard to prior authorization. It requires insurance plans to provide behavioral health treatments, like for those of our children who are autistic, as part of the minimum benefit standard. It encourages investments in new therapies to prevent, diagnose, and treat acute and chronic disease with a tax credit for innovative biotechnology research. It ensures that minor children qualify as exchange eligible and provides for the availability of child-only health insurance coverage in the exchanges. It stops insurance companies from denying coverage for pre-existing conditions, health status, or gender. And it ends the medical benefits shell game that insurers have played with people's lives. Bottom line is, this legislation helps New Jersey and it helps America. It is fair, balanced, and fixes a badly broken system. It is truly an historic piece of legislation and will be remembered as such. And yet, every one of my colleagues on the other side will vote no. They will stand against all of it, all that I've talked about, firmly, once again, on the wrong side of history. So let me conclude, Mr. President, by saying, I've said it before, and I'll say it again, history calls on us to stand up on rare occasions for what is fair and just and right for the American people, and this is one of those occasions. This is a time to look into your heart, time to see beyond your own political interests, your own hard ideology, and look at the lives of millions of Americans. Think about the millions of families on Main Street in every community where a child wakes up in the middle of the night to a parent who cannot afford to get them basic care they need. And ask yourself, what's the right thing to do? This is a time to do what's right for America. It requires more than parliamentary maneuvers to slow the process. It requires more than shrill voices raised under the banner of free market values at the expense of fundamental human values. It requires doing what's right for the millions of American families who have lost their jobs and their health care, those who have suffered from the economic policies of the last 8 years and now find themselves hurting. This is a time to remember them, time to remember every mother who cries herself to sleep at night because she lost her job, lost her health care for herself and her infant, and could lose everything she struggled for in her life if she gets sick. I say again to my friends, how dare you deny to her the protections that you so fully enjoy yourself? How dare you turn this into a parliamentary game of delay, deny, and defeat? Those who have continuously said no to any attempt at health care reform and yes to the needs of the insurance industry believe that the business of government is business. But for all of us who know the business of government, what it really is, it's about people. It's those who send us here. It is their lives, their hopes, their dreams for a better life for themselves and their families. This is an opportunity to stand up for them. This is an opportunity to take care of their health care. This is an opportunity to show on whose side you're on. Are you on the side of those families, or are you on the side of the special interests that would have you vote no, on the ideological interests that would have you vote no against these families? This is historic legislation, and I'm afraid that our friends on the other side will once again, as they did in Social Security and Medicare, find themselves on the wrong side of history. Mr. President, I intend to be on the right side of history and to vote yes for this legislation. And with that, Mr. President, I yield the floor.